Tell me why you were so excited for this opportunity to talk about your experiences with Cherry Health.
Well, I had a great time on rotation here as a student in my 4th year of pharmacy school. I felt like my career path changed, and I felt like this place really made a profound impact on just my life in general. A couple of years ago, I volunteered to do a community outreach program. Students come in and we take patients' blood pressures or their blood sugar, and it gives that patient who maybe had not had any contact with any medical professional before a touch point. Being on this rotation here, I saw just how important it is to make that connection. Maybe just the first connection that the patient has ever experienced with healthcare.
The outcomes are what are unarguable. That if you bring in the right kind of expertise that the patient needs, care can be transformed. When we thought about it, we couldn't measure it, but one of the patients who had a really hard time and had a lot of other kinds of life issues, as you understand now, seeing how people live and other kinds of things, she said, you know, I wasn't feeling too good about myself, but the team at Cherry Health spent a full hour and a half with me. And then my pharmacist spent an hour and a half with me. And then my doctor and my pharmacist put their heads together to create a plan just for me.
Wow.
And I realized how important I was. And we can't measure that, but I think there's something there about the time and attention given to the individual that makes them invest in themselves. That was not always how pharmacy was. It wasn't always invited into the care planning. In my career, in part of education, people were surprised to see pharmacists up out of the basement in the hospital setting. The next venture is how do we extend that with electronic health records and communications, which was how we got out of the basement and stayed in the basement, because we had a paper record, we saw each other regularly, and we could establish those trust relationships. Same in the clinic. We're going to have to figure out how to do that more virtually as we move beyond the 4 walls of hospitals and clinics.
It's nice to hear that Cherry Health kind of has that model going for it right now. And the envision that I have for the future of pharmacy as a current pharmacist is more involvement with the patient in the continuum of care and working in a team-based approach with physicians. And that's really, this model here at Cherry Health is really what I want for the future of pharmacy and for the future of healthcare, because it's only going to benefit the patient. And it's just nice to be a part of that, you know, as a young learner that I was, just on the first rotation, being a part of that type of exciting new step for pharmacy. Cherry Health, you know, using what we have here, these great pharmacists here and these pharmacy students, the great physicians and every other medical professional, expanding our boundaries is only going to benefit the community and different parts of the community, wherever we decide to move on to. And I think that it's incredibly exciting to be a part of that.